spine surgery. It's a huge decision. So let's talk about how it's actually made.
If you've got back pain, you've probably asked yourself, is this really necessary?
And look, it's totally understandable. Surgery can feel like the absolute worst-case scenario. But we've got to bust a big myth here. Surgery isn't always a last resort or a failure. For the right patient, it's not a failure at all. It's actually the moment things turn around.
It really starts with this philosophy called motion first. The whole idea, restore function first.
So the conversation doesn't begin with surgery. It might be physical therapy or even precision injections.
And this question right here, this changes everything. It's not can we, but should we? Okay, on to myth number 2, that the whole decision comes down to one MRI scan. But the truth? It's way more layered than that. It's a human decision, not a technical one. In fact, there are 5 key things that go into this decision. Let's break them down. You see, the recommendation is really anchored in what you need and what you want.
And making that call comes from incredibly deep and specialized training. We're talking years of it.
Okay, let's talk about recovery. There's another huge myth here, that it's only physical. Now, research does show that certain clinical factors can point toward better outcomes.
But, that isn't the whole story, not by a long shot.
It turns out your mindset, things like confidence and trust, can totally shape your recovery. I mean, listen to this. The confidence came back before the surgery. That's huge. That's why building trust isn't extra. It's actually a core part of the treatment itself. So when should you actually have this kind of conversation? When is it the right time? You don't have to wait for a crisis. If any of this sounds familiar, it might be time. And you know what? Most people aren't hoping for surgery. They're just hoping for some clarity. A specialist's real job is to give you an honest assessment and a clear plan forward. So maybe the first step to feeling better isn't a procedure, but simply a conversation.